Hello, and welcome to our webinar, Employment Support in the Healthcare for the Homeless Setting. My name is Melissa Da Silva, and I will be moderating today's webinar, which is a production of the National Healthcare for the Homeless Council, made possible by a grant from the Health Resources and Services Administration, Bureau of Primary Health Care. This is a 1-hour presentation with the last 10 minutes reserved for Q&A. At any time during the presentation, you may type your questions for our presenters in the chat box below the presentation slides. Questions will be answered at the end of the presentation during the Q&A session. This webinar will be archived on our website at www.nhchc.org within 72 hours. If you're experiencing technical issues, please call Ben Rock at our office, 615-226-2292. Thank you again for joining us to learn more about supporting employment activities of HCH clients. This webinar is one of several resources from the Council in the area of workforce development and our initiative on community health workers. Just over 2 years ago, the Council developed and staffed the role of consumer advocate to primarily support the National Consumer Advisory Board, or NCAB. NCAB consists of homeless and formerly homeless persons who have been clients of HCH projects across the country and who are involved in the governance of those projects. NCAB is a standing committee of the National Healthcare for the Homeless Council, and NCAB's elected chairperson sits on the National HCH Council's Board of Directors. One of the first resources produced by our consumer advocate in 2011 was a guide for administrators on the benefits of community health workers. This guide is located on our website under Resources, Tools, and Support. Please don't hesitate to call us if you need navigation assistance, as our website is large and dense. In addition to this guide and a variety of other resources, the consumer advocate's major function is to ensure NCAB's participation in all of our work, but especially those projects that might impact the lives of persons experiencing homelessness. Today's presenters will focus on some of the more subtle strategies of employment to assist HCH providers in navigating this possibly delicate topic with their clients. Luckily, our presenters are both knowledgeable and charming, and in the case of our second presenter, passionate about this work. Ms. Yvonne Nair is the founder, CEO, and executive director of Saffron Strand, Inc., a Richmond-based 501c3 nonprofit which builds the job skills and increases the long-term employment of homeless adults in Richmond and other West Contra Costa communities. Yvonne has worked with nonprofit organizations active in public health and human services for much of her career. As a nonprofit executive director, she has led the growth and development of large and small organizations working with marginalized populations in diverse communities. Last year, she received the Jefferson Award for Public Service for her work with the homeless. We are so pleased to have Yvonne with us as a presenter today. Our first presenter for today's presentation is our own consumer advocate, Mr. Brian Zralek. Brian is a consumer advocate at the National Healthcare for the Homeless Council. In this role, Brian coordinates and organizes the work of the National Consumer Advisory Board, and he has a background in intensive case management with people who are chronically homeless, community organizing, and nonprofit management. And in his own words, he has been a consumer advocate all of his professional life, paid for this work, though, maybe only recently. And so with that, I turn the mic over to our first presenter, Mr. Brian Zralek. Brian?
Okay. Thank you, Melissa. And I want to give a quick thank you to our work group that has helped Yvonne and myself with this project. That includes Rodney Dawkins from the Heartland Health Outreach HCH in Chicago. He's also an NCAB member. Joseph Benson, also an NCAB member, actually chair of the National Consumer Advisory Board from HCH in Houston. Christina Blessant from Saffron Strand. Rachel Post from Central City Concern. Bill Friskus Warren from United Neighborhood Health Services in Nashville. And Deanna McKay from America Works in New York. So again, welcome. We're going to be talking about employment support in the HCH setting today. Okay, so our focus today is on 3 aspects of the employment support approach. First, we'll be making the case for the importance and relevance of employment support in the HCH setting, then give some detailed examples of what that can look like. And finally, we will provide information about modalities and attitudes that can facilitate support for employment among HCH providers. So what do we mean by employment support? Well, first of all, the purpose of the webinar is really to offer providers basic tools that can help them support their clients' motivation for work. There are employment agencies, some affiliated with HCH projects, many separate from HCH projects, that provide in-depth hard skills for job-seeking clients. In this webinar, we are not recommending that HCH providers necessarily take on the role of employment agencies, but merely that they incorporate these basic skills into their practice to support their clients. We do recommend in this webinar that providers work closely with employment agencies, some of which we'll talk about, by making referrals and coordinating care. We'll also discuss opportunities to include a focus on employment as part of a holistic, patient-centered approach to healthcare for the homeless. So, first of all, why are we talking about this? There are two common denominators of HCH clients, as we all know, involving housing and healthcare. What causes homelessness? This is something everyone's pretty familiar with, but poverty often forces families and individuals to decide whether to prioritize rent over healthcare or the other way around. Sometimes healthcare expenses win out and lead to a loss of housing. Job loss and bankruptcy also play a role. Loss of insurance and untended health concerns. All these factors become intertwined and lead individuals to seek assistance at HCH projects. There are other factors as well, such as lack of affordable housing. Other systemic issues obviously play a role. So these are factors which influence temporary or episodic homelessness. And compared to people who are considered chronically homeless, we may think of people experiencing episodic homelessness as more employable. Let's just talk for a minute about chronic homelessness. Mental health issues, problems associated with substance abuse, and physical disabilities are leading causes of chronic homelessness. Dual disorders, any combination of these three things, can also be particularly disabling. Are people who are chronically homeless employable? The basic answer to that is yes. HCH projects serve both people considered episodic and chronically homeless, and people in both categories can and do benefit from an employment focus. And the HCH setting is an optimal place for using employment as a support or an intervention. For clients who are in active addiction or maybe are not quote-unquote stable medically or regarding mental health, those that mention employment or those who respond to a question about employment, who say, yes, I'd like to do that someday, or yes, I really want to work, it's important for providers to hold on to that and use that as kind of an ongoing motivation for recovery and stability. What are the barriers to employment? And so it's necessary to explore kind of hard barriers, but also the perception of barriers and the role that the patient and provider perception plays in blocking or supporting an individual's desire for employment. A disabling medical condition, obviously physical or mental, can make activities of daily living more challenging. And I'm not going to go into great detail about that or types of conditions, but obviously those can be limiting. Criminal background screenings and questions on job applications about felonies can make finding gainful employment, even decades after incarceration, more challenging for people. These also include racial discrimination, negative experiences with bureaucratic systems and other traumas that lead to mistrust of perceived and real authorities, including potential employers. And of course, all of these factors can intersect and lead people to really kind of see their experiences, the condition, whether it be mental health, physical health, substance abuse, or other experiences, see those things as insurmountable. So those are barriers. So let's talk about seeing beyond those barriers. What does it take to overcome or transcend those barriers? Again, just to kind of reiterate, there's a myth, that we've all heard, that individuals who are homeless just don't want to work or cannot work. And so that myth is potent, insidious. It gets into both, those of us who are kind of on the caregiving end, as well as those who are on the receiving end of services. You can see it, you can see that people begin to believe that they can't work. However, if you look at these studies, you can see that there are, in fact, the majority of people who have been surveyed express a desire for work. Out of 182 men and women in Sacramento, 87% expressed a desire for employment, 91% in Houston, 74% in Baltimore, and 65% in Portland. So, work promotes dignity and respect. That's something that we all know. So recognizing the falsehood of the myth of lack of desire, using a patient-centered, strengths-based approach enables the provider and the consumer to effectively transcend that barrier. So an employment focus is holistic and patient-centered. We view homelessness and associated health concerns as interrelated. In the HCH setting, we see these things as multi-causal. So we must view employment in a similar way. We must see it as patient-centered and holistic. And it should be addressed alongside housing and health needs as part of a holistic wraparound strategy, if I may use that term, wraparound. We also we can think about employment in terms of jobs first, similar to housing first. So employment is also therapeutic. This kind of goes without saying, even though oftentimes folks who are working experience stress on the job. We know that the benefits far outweigh that stress. Benefits of earning a paycheck go beyond the monetary reward and include increased self-esteem and self-worth. And studies actually show that employment is associated with unemployment is associated with increased anxiety and affective disorders. On the other hand, employment is associated with better mental health and even improved physiological function. So that's just something to keep in mind and maybe kind of understood, but there's actually research that is demonstrating improved immune function. There are also other benefits, obviously insurance, whether employment sponsored or the ability to pay for private insurance, possibly the socialization that has to take place in the work setting. Those are all benefits that many of us take for granted, but are extremely therapeutic. So with that, Yvonne Nair is now going to talk about what employment support looks like.
Thank you, Brian, and good morning, everyone. Thank you for attending this webinar. So what does employment support look like in the HCH setting? So first of all, trust and rapport between the provider and the patient. So the provider already has built a strong relationship of trust and rapport with patients based on the meeting his or her healthcare needs. This relationship allows the provider to introduce discussions about employment which are patient-centered, and the patient is going to be more receptive to such discussions because of the close relationship. In the conventional employment services, the main effort is to match a person's technical skills to specific needs in a job market. And in such services, there is less concern for patients' individual circumstances. So, and then about respectful and interested. In this, what I was thinking about is, as a continuation of the healthcare discussion, the provider can mention employment. Based on their one-on-one relationship, the provider can develop a series of respectful questions. Also, National Healthcare for the Homeless Council offers a toolkit with tips on how to ask questions about employment without the provider needing to be the employment specialist. And then provider encouraging the patient to meet the challenges and overcome barriers. The provider recognizes that the patient will have to overcome multiple barriers to achieve employment. As the discussion develops, the patient is likely to bring up other barriers, which include gaps in work history, unavailable references, criminal record, lack of phone, computer access, appropriate clothing, childcare, transportation, resume, etc. So the provider should acknowledge the challenges facing the patient and suggest first working on those that are less difficult to solve. And then, of course, provider knowledgeable about the appropriate resources. We hope that the healthcare provider can refer the patients to a nearby employment supportive services. Such referrals can be more difficult in small towns and rural areas. However, when the provider is sensitive and attuned to the patient's employment, then there's a much greater potential for the patient to start looking for employment. So, the next slide. Here it's about more tips on how you can improve your patient thinking about employment. With healthcare appointments that don't conflict with scheduled employment services. The patient may have a difficult time in meeting scheduling requirements of healthcare, housing, and other employment supportive services. The healthcare provider can be sensitive by scheduling conflicts in order to help optimize the opportunity for employment. This approach shows the patient that the employment is important and that the provider supports the patient. And intake interviews, which include employment-related questions. Here, the provider can show orientation towards the patient's employment during intake. Each provider may want to develop their own questions, but National Healthcare for the Homeless Council has a toolkit that has sample questions that you can springboard off or use them. And then the other thing we see is prescription with side effects that do not conflict with the ability to carry out the job function. Often we see patients on medications who struggle to keep appointments and stay awake during work. So when the provider, would it be possible to prescribe medications that don't interfere with the patient's job performance? So another point, effective communications between the medical professional and patients that's respectful and empowering. And I think this is really important. After building a trusting relationship, at least what we see is that the patient often tells us, that they have a mental illness or a substance abuse, and they're very scared to go back to work. And so from the provider end, I think it would be really helpful and empowering to encourage both verbally and non-verbally that the patient is able to go back to work and help build their confidence to get back to work. And then also staff interest in and support of the consumer's transition to employment. It's important that the provider staff also show in the patient's progress towards employment. Staff support further empowers the patient. You can say things like, great, I heard you were looking for a job. How's it going? So it shows interest that you want the patient to move forward. And then knowledge of collaboration with employment services and also working with the consumer. The patient benefits when the healthcare provider knows about the employment services for the patient. So when the provider can collaborate with the employment services professional, the patient is more likely to experience a successful transition to employment. The next slide is for a lot of or some of the patients do live in shelters. So this is more tips for the shelter. Referral to collaborating employment services within 7 days of entering the shelter. And this is some of the challenges that we have working with our members. We call members, not patients. At the end of the shelter stay, the patient is really looking for another shelter, not employment. If the patient is constantly moving from shelter to shelter, then it's impossible to sustain job training, build work-related relationships in the community. And also, enforcement of sobriety at dry detox shelters, which increase the probability of the patient finding and keeping a job. And that's pretty self-explanatory. For a patient in the early stages of recovery, returning to the shelter where others are drinking and can interfere with the person's effort to stay sober and keep a job. And we've experienced that, and our members also have mentioned that. And then the ability of the patient to receive and respond to employment-related phone calls. So sometimes employers are willing to call the shelter. They need someone so badly that if your patient is a contender, they will call. But those calls have to be related in a timely fashion, because if not, that is such a huge missed opportunity. And then the other thing, provision for the employment-dedicated phones at shelters for use of the patient. The provider can increase opportunities for employment by promoting employment-supportive environment. Communication technology, as you know, is critical in getting and keeping a job. So, both the healthcare and housing service providers should encourage their consumers to take advantage of volunteer opportunities in the community at large in order to help others and give back to the community while building their work skills and integrating back into the community. So that's my part of it, and now I'm going to turn it back to Brian.
Great. Thank you, Yvonne. Yvonne talked about some practical steps that providers can take. We're now going to talk about how to offer the employment support, and really kind of from more of a attitude basis. So what does it take? What sort of mindset does it take to really incorporate employment support as healthcare, essentially, and as a way to address homelessness? So as Yvonne mentioned, it's critical to be knowledgeable of community resources. Oftentimes, cities, communities have resource lists, and HCH providers are probably already aware of a lot of these. But every community, of course, has their own kinds of services and service providers. Some community resource providers focus specifically on assisting individuals with obtaining employment. There are various kinds of employment supportive agencies. Those include one-stops, supportive employment programs, homeless veterans reintegration programs, alternative staffing organizations. Each of these kinds of services provides a unique set of services to their consumers. For example, the alternative staffing organizations develop relationships with employers and provide a temporary, kind of a temp to permanent job for consumers that come for their services. And then others, provide really more intensive job readiness classes, building resumes, practicing interviews. So each is kind of unique. So HCH clients may need to rely on public benefits as well, such as food stamps or SNAP, temporary assistance for needy families, or general assistance in some states. Some of these programs have built into them employment components. either there's a requirement to be looking for work, or there are kind of allowances or incentives for looking for work. Of course, clothing and food pantries are critical as well as resources that can be useful for clients interested in employment. So the more that a provider is able, is knowledgeable of these things, the more easy it will be to connect and make referrals. Yvonne mentioned the Employment Support Toolkit. That is something that we at National Healthcare for the Homeless Council are working on. This will be a document that can help HCH providers and others look at the various steps that it takes to really integrate an employment support focus into their practices. It gives providers insights and information on types of resources that can support an employment search, as well as types of questions providers can ask consumers that can help elicit conversation and support consumers' search for employment. It's a way to engage consumers meaningfully and can be thought of in the context of motivational interviewing and the strengths-based approach. And it also helps clients make the employment search really more their own. So some examples of employment support questions, again, using kind of a motivational interviewing lens, like open-ended questions, affirmations, reflections, summaries. These things build support and build motivation for clients who are looking for employment or beginning to think about employment. Very simple questions. What do you think about working? What do you like about working? Do you have a resume? What is your dream job? We're seeing these sorts of questions, being kind of on a casual basis, or they could be integrated into kind of an intake or assessment process with clients. It could be just a normal part of intake, how's your job search going, or are you looking for employment? That file then gets passed on to a case manager who can follow up on the next visit, or to a clinician who, looks at integrating this into what else is going on health-wise for the person. And further down the line, how's the job search going? How did the interview go? What do you like about your job once someone gets hired? What are some of the challenges of your job? And to take it a step further, some places have really integrated an employment component into their mission, really seeing the value of employment, the dignity and respect and progress, really, that it helps people make. So with this, we're asking agencies to look at mission and values, how they view client health and stability through an employment supportive lens. Looking at operations and programming, are those set up with a focus on employment? Is there, as Yvonne was saying, a way that providers can, have hours that could allow them to be available for people who may be working during the day? How familiar are providers with employment supportive services in your community? How well acquainted are providers with businesses that hire people with felony records? Another thing to think about is looking at internships and volunteering. There are, as I was saying, HCHs and their associated organizations that really look at employment within the organization as a viable piece for the consumer or client, as well as a viable piece for the organization itself. We know that consumer governance and consumer input really adds a level of connection and effectiveness and integrity to those organizations that really take the consumer governance and input very seriously. And I think the same is true for consumer employment in the HCH setting, itself. Who are your employees? Really looking at that. What's your organization's policies around hiring consumers? Can you carve a niche or a job for clients as employees? What does your board think of this? How does your CEO or executives view the role of employment in your operations and your programming? So we have moved along pretty quickly with this webinar, but we've covered quite a bit of ground. So I just want to reiterate a few things, and that is that the employment supportive focus is holistic and patient-centered. Very much, we believe, belongs in the HCH setting. People who are homeless want to work. Employment is part of a bridge to health and housing. Aside from the obvious, including the ability of taking care of oneself materially, employment support helps physiologically and with mental health needs. There are practical steps that providers can take in order to integrate this focus. Providing employment support can happen anywhere in the HCH setting. That could be from the front desk to the case manager to the clinician. And then finally, how do you operationalize employment support in the HCH setting? Employment support may be most effective and sustainable when it is actually part of the mission and fabric of the HCH project. So that is the webinar presentation, and I will hand it back to Melissa for Q&A.
Thank you so much, Yvonne Nair and Brian Zralek, for that pretty tight and succinct presentation on employment support for the HCH setting. We do not have any questions from our participants out there. I would like to remind folks that we've mentioned the employment support toolkit that will be released within the next couple of months. We actually will have 2 guides coming out before June on this topic, so employment-related guides for HCH settings. And as I say that, there is one question. So we have a participant question, and it's Joanna, thank you. The question reads, she would like someone to comment on the reality that most healthcare providers simply don't have experience with employment, are overwhelmed with their current healthcare duties, and I guess really don't have the time to become acquainted with the resources that might be useful.
I think that is a challenge, Johanna, and I think it's important that's why we're having this conversation, and that's why we're doing this presentation, is to show ways, without being an employment specialist, that you can add a few tips here and there to encourage the patient to start thinking about employment. Again, it's not taking on a whole lot. It depends on the agency and their commitment to employment, and so each one to its own level of comfort. But the most important thing is to start talking about employment and to start, doing the transitioning earlier than later in the stage of recovery.
Thank you, Yvonne. As I say that, as I mentioned, we didn't have any questions. 3 or 4 came in. So we do have another question, and I want to say that this is also a question for you, Yvonne. Irene is asking a 2-part question. 1, can HCH projects directly communicate with potential employers? And 2, maybe she's inquiring, is it not already a part of the HCH project mission to be more actively involved in employment-related services for their clients?
What a wonderful and exciting question, Irene. You're not scared. I appreciate that. My fear was, providers would feel that it's too much. I think, again, it's to the comfort level of the agency. If you have an employment arm or piece in your agency, I think it would be good for you to reach out to employers if you feel your patient is ready for work and you want to take on some of the responsibilities of employment. You're welcome to do that. Our fear was that healthcare providers have so much already going on that might not be something you want to do. I think there are some healthcare providers that are providing employment supported services as well as I know. And I think Brian could answer that question through Healthcare from the Homeless. How many of these agencies actually have that portion, that part in their organization?
Thank you so much for that question, Irene, and for your response, Yvonne. Irene, I see you've got another follow-up question, but before that, I think Brian has a comment related to our database, which HCH projects actually have active employment initiatives. In addition to that, Brian, there is a question from Andy, and his question is, are there any federal funding opportunities for supported employment programs? I am assuming in the HCH setting. So, Brian?
Right. So, first of all, we are collecting data on exactly which HCHs have an employment component alongside their other services. I do know that Central City Concern in Portland, Oregon is a great example, and I'll also use Central City to answer the question about federal funding opportunities. I know that they have leveraged federal funds to support their supportive employment programs, and I know that Department of Labor is a good place to start to look for funding for employment support. So that would be the answer to that.
I think we have a follow-up question. Oh, no, this is a new question from Joanna. Okay, this is a question probably for both of our presenters. Let's go ahead and start with Yvonne. And Yvonne, the question from Joanna is, please share your thoughts on using members/consumers who have begun employment, I guess recently begun employment maybe, to assist in the healthcare HCH setting, possibly as bridges? Yvonne.
Okay, you have to repeat that question again. I didn't quite understand that question.
Sure, and I probably didn't state it well. Joanna is wondering if you could share your thoughts on using consumers to serve as bridges in the HCH site, consumers who have begun employment, who are now employed, to serve as bridges, I guess, in the conversation between providers and other HCH clients in this discussion about employment.
Well, I think if I'm understanding the question correctly, the members, consumers do provide a rich resource on their challenges in the employment setting, and I think they're one of the most valuable resource that we can have in order to understand the needs of employment, and especially in the HCH setting.
Sorry about that. I think I did a poor job of interpreting Joanna's question. But I think Brian can offer us a response that might get more at an example of how consumers are currently serving as quote-unquote bridges in this conversation. So, Brian?
Right. So there is a program that we at National Healthcare, the Homeless Council, are helping administer. It's a community health worker program, and this is a program which employs formerly homeless HCH consumers in several HCH projects around the country. It's connecting people who are high utilizers of emergency rooms with HCH projects in those communities. So it's I believe it's part outreach, part case management, part mentor, and it's proven to be a best practice and a way to really use the expertise of consumers, and I would say to be a bridge, absolutely. And then, in other settings, they might be peer mentors, peer support, and in some places it's hiring people who are qualified. They've been through the programs and they're qualified to do the same jobs, not necessarily in a quote-unquote peer way, but as receptionists, janitors, kind of an open opportunity, fair, kind of a open market kind of thing.
Can I add to that, Melissa?
Please.
Now that I understand the question a little better.
Please.
Okay, so I think one of the concerns would be when we're getting our members, consumers ready, work ready, and especially in a healthcare setting. And I think this goes back to also when consumers were becoming substance abuse counselors, that we make sure that they are work ready in the environment, because a lot of our homeless people are traumatized, and what we don't want to do is put them in a setting where they can experience that trauma again. So when we're training, while they're a great bridge, we want to also make sure that they have the training and the expertise to navigate that. And I want to be sure to put that in as well, because that is really important when we use consumers to be in the setting that, and a good example is like a wounded healer. If you're going back and you're giving back in a place where you've experienced that, you want to be sure that you are ready to help the individual without being re-traumatized by what you've experienced, helping others through theirs.
Great. Thank you so much. Apologies again for not being clear with that question. So we have, I think, a follow-up question from Irene, or maybe a clarifying question from Irene. And I think, Yvonne, you touched on this earlier. So Irene's question is, can the health center serve, again, as this bridge idea, or be the connector between a specific employer and a specific consumer or client of the HCH setting? I think, Yvonne, you mentioned that, this will vary from health center to health center depending on their capacity and their comfort. But let's maybe do a round back and forth. So Yvonne first, and then Brian.
Okay. So again, if the healthcare center wants to take on the employment piece, then you want to be careful that as you're getting the individual ready, that the healthcare center understands all of the components that you're getting this person ready. It's not just about the resume, are you work ready? Everyone will say that they're work ready, but there are technical skills that still requires help with social skills, and so all of that. So before you engage the employer. Make sure you have relationship with employers out there if this is what you want to do. But also, when you are getting the individual connected with the employer, that they are work ready, that they understand what it is. If they've been out of work for quite a while, if in theory, if you feel like, oh yeah, I can able to do it, in actuality, and that's what we've seen at Saffron Friend, is that the 20 hours a week can be very challenging, and so employers would love to hire people who are work ready. But what they're not willing to do is putting in that time to get the person ready for work and doing all the extra. They want someone to come with most of the skills they're ready to go. So I think it's a great question. I appreciate that question because you're thinking about employment and how you can engage, but also to be mindful that when you do engage with the employer, make sure that your client, your patient is ready to take on the job.
Thank you so much, Yvonne. And Brian, do you have some thoughts on that?
I would add that it does depend on the particular agency. When you have an agency that is willing to take on a consumer, let's say, in kind of a voluntary role or in a role that is kind of service-based, I think that provides the HCH project some background for we know this person, but we also know how this person works. This person has demonstrated that he or she is responsible and diligent or whatever it may be. So I think, like Yvonne is saying, a provider that doesn't have that knowledge of somebody may not be the best reference for somebody. But if that project has a component or a program that involves consumers or former consumers in some way that includes responsibilities, then there is some kind of work-related knowledge that HCH project can use to really serve as a good reference. So it kind of depends from an organizational standpoint, I would say.
Thank you again, Yvonne and Brian, for your responses. We have a question here from Cassandra. Cassandra is asking us about, this is a long one, so I'm just going to read it. As you look at the data that you are collecting, do you see trends in the effect on homeless unemployment when healthcare providers participate in motivating individuals back to employment? Or is it too early in the data collection? I can answer the second. It is too early in the data collection, but it's possible that Brian has a sense maybe from his conversations or maybe some anecdotes to offer us on this.
Right. Anecdotally, I would definitely say that the more people who have some role in caring for HCH clients who actually invest in talking about employment as just part of a whole person, holistic care, I think that's really only going to be an extra support for people. I think it can really only benefit. It's just kind of that extra level of understanding and kind of person, I've got your back, I'm in your corner, So I think we all know that from personal experience, a family member or loved one who supported us, known what kind of person we are or whatever it is, So I would say it's a positive, and I would expect that with this kind of implemented, I think that we would see some positive results.
Can I add something to that too, Melissa?
Please.
Yeah, and what we've seen is that when we have a collaborative effort with the healthcare, with housing, and employment, it goes pretty smoothly because the client-patient member feels pretty important and empowered that we're working to their benefit, and that's what we've seen at Saffron Strand, and we were hoping that there were others out there that might see a very similar trend. So, Brian, it's wonderful to hear that that you see those trends as well.
Excellent. All right. Thank Thank you, Brian and Yvonne, for an excellent presentation and great engagement from our participants. So thank you for your end of presentation questions. I hope we've attended to them at least to initial superficial positive intent, and know that we are available for follow-up questions, conversation, TA, on this issue. Brian is on staff at the council. Yvonne is a constant partner of the council. And we have on our next slide some content-related resources for, I guess, follow-up information on this topic, in addition to the guides that we will be producing hopefully by May or June of this year. So visit our website and or check your inbox for those announcements. In addition to those resources, we have council-specific announcements. We have a national conference coming up in March 13th to 16th in D.C., pre-conference institute and a 3.5-day regular conference. Please check our homepage for more information about our national conference. We have a few webinars coming up, some really exciting topics, Medicaid eligibility and updates on the Patient-Centered Medical Home Initiative. And again, look to our website for soon-to-be released guides on employment support, trainings in different regions of the country, and a variety of other newsletters and publications from other program areas of the council. Thank you all again, presenters. I think we've got a couple of minutes for any final thoughts. So let's see if, Yvonne, do you have any parting thoughts for us and our participants?
Absolutely. I wanted to thank the participants for taking the time to hear about what HCH providers can do to help with the employment piece, because I think they're such a critical partner and a piece to the work that we're doing. And so I appreciate everyone attending, and I hope that we can continue the conversation further. And if anyone has any questions, please don't hesitate to contact me. Melissa had put up the website. Our contact information is there. We love to be part of this discussion to move it forward. And I thank National Healthcare for the Homeless Council to take this on, and Brian and Melissa for championing this and seeing it through. Thank you, guys.
Thank you, Yvonne. And Brian, do you have some parting thoughts?
I just want to echo what Yvonne said. I'm just grateful that we had a good turnout, good questions, and I believe that this topic is of great importance and can have a very positive effect on the people that the HCH clinics serve, as well as the HCH projects themselves. So glad that I could help, and we look forward to hearing from everybody else in the future. Thank you.
Thank you all again for joining us for today's webinar on employment support in the HCH setting. Please take our survey as you exit the web meeting room. Wishes for a lovely day, and see you next time.